At the time of surgery, the surgical team take a vast array of measures, including prophylactic antibiotics, those are antibiotics that are given at the beginning of the operation, as well as measures to decrease the bacterial count, such as filtering the air in the theatre and using special preparations to keep the skin clean. In order to decrease the risk of infection, there are measures that patients can take preoperatively. It is important to get all of the illnesses that the patient suffers from in as good a condition as possible. For example, controlling their blood sugar levels if they have diabetes. There are also lifestyle choices that are really important, such as stopping smoking, and also if patients are very overweight, trying to lose weight prior to surgery. All of these will decrease the risk of infection.
I think a lot of people underestimate the significance of joint replacement surgery. It's not a small surgery, it's a huge surgery. It's mitigated and it's downplayed a lot by the NHS and it's downplayed by consultants because it is routine to them, but it's not routine to a person.
It's 1 in 100 to get an infection, so you just hope you're not that one.
The classic signs and symptoms of infection are unexplained pain. There are systemic or general signs such as fever, feeling of unwellness and high temperature, and then there are localized signs such as redness, swelling, pain, and also any discharge from the wound, particularly discharge that comes on late after the wound is healed, or any pus coming out of the wound.
Yeah, I knew something was wrong because, one, it was very painful. I couldn't move the leg because it was so painful to move. It was bright red and extremely hot. And I was ill. I had a high temperature, felt sick. I started hallucinating.
Patients who present with an infection soon after the operation, which is most patients, right? And then you know the sooner it is after the operation because you know that they got infected at the time of the operation. That's when the bugs went in. But some people present with an infection 3 years later. Now, is those bugs that have been dormant, because we know bacteria can stay dormant for hundreds of years, and the bugs have been in there since the operation and they've slowly started growing, in which case, when did they start growing? Or have they got infected because they had a tooth taken out and it got to the hip via the bloodstream?
I don't think I'd been anywhere else to pick it up that I know of. And they say, well, it could have been, it's just dormant for 5 years and come up again.
Well, we just never thought it would happen. We just never give it another thought, really. And then he suddenly woke up saying, I'm in awful pain, and it just got worse. But we certainly didn't expect it to be the infection raising its ugly head again.
Because I was on antibiotics, you think, give it time. I've only been on them for a week. It can take longer than that for them to properly kick in and properly work. So I did keep my initial concerns to myself.
It can be normal to have some pain after an operation. It can be normal to have some swelling. But a crucial question is, what's the trajectory of that? How has it changed?
You've had this operation thinking that life is going to be so much better now because you're not in pain, you're able to walk, you're able to go back to normal. And then all of a sudden, then it's like, right, this has now happened. Is all that gone?